Hello, everyone. It's Dr. Joe Marquez again. Just want to follow up on this topic of diabetes medications becoming obesity medications. So these are the three main studies we spoke about last time that helped us get from us trying to discover a new diabetes med and ended up with a medication that also manages obesity quite well. But all of these studies were focused on patients who were diabetic and trying to monitor the weight loss. Here in these studies, they're newer from 2022 and 2021, this one being the Surmount-1 trial and this one being the STEP-1 trial. Both of these focusing on Zepbound or Tirzepatide and Wegovy or Semaglutide. Both of these studies were focused on weight reduction, not so much on improving diabetic management, but just solely on weight reduction and does it help. And both of these studies kind of confirmed that yes, even for patients who do not have diabetes, these medications are safe and effective for weight loss. But when we look at these medications, both Wegovy and Zepbound, they fall in this category of medications, meaning they affect the same receptors as our endogenous self-made hormones that we call GLP-1 and GIP. Okay, and because they affect the same receptors, we call them GLP-1 and GIP receptor agonists, meaning they do the exact same thing as these hormones. But when you compare these medications to their natural counterparts, there are some differences. One, their potency for the medications is higher, so they affect the receptor more aggressively than a natural compound, and they last longer. Instead of lasting minutes naturally, they last for days. And this is great because it allows us to take this medication once a week, as opposed to having to take it consistently as you would with a natural compound that only lasts for minutes. And its effect on appetite is much stronger than the natural compound, and blood sugar control is much better as well. But who would benefit from these medications? These studies showed that if a person has a BMI over 30, they would benefit. But even if their BMI is above 27, if they have conditions that puts them at higher risk of having metabolic issues, such as diabetes, hypertension, and high cholesterol, potentially these medications might be beneficial as well. As far as options, we have been focusing primarily on these two, and rightfully so because they are the most popular and probably the most effective medications. But they also have a cousin called liraglutide or Saxenda. It's injectable, very similar to Wegovy. The main thing that separates it is two main things. That it's not as effective at reducing weight as Wegovy, and two, instead of being a weekly injection, it's a daily injection. So it's a little bit more annoying, you get less bang for your buck. So it's just not as popular, but it is an option. And then another group of medications that we haven't really spoken about so far is in this bottom table. The first one being bupropion and naltrexone, also called Contrave. These medications mainly work by blunting the desire to eat. So it just reduces your appetite by a different mechanism, but it can cause some good amount of weight loss in patients. The next is phentermine and topiramate, also called Qsymia. This is a stimulant, like a cousin of Adderall, puts your metabolism into hyperdrive so you burn a little bit more than you normally would. So it can be very, very effective. Plenity is a hydrogel. It's a capsule that you take 20 or 30 minutes before you eat, and as it goes into your stomach, it expands and gives you just an earlier sensation of being full. As far as side effects, specifically talking about Wegovy and Zepbound, the most common issues they can cause is GI concerns, so nausea, vomiting, diarrhea. In order to minimize this risk, we start you at a lower dose and over time increase the dose, giving your body time to adjust to the medication and decrease these problems. Another issue is pretty uncommon are injection site reactions. Now, they can happen, they can irritate the skin where you do get injected, but especially when it comes to Wegovy and Zepbound, they're weekly injections, so they're not very common, or often I should say. And because of that, the risk is a little bit less. But if you were to compare it to liraglutide, which is again, it's a cousin of Wegovy that's a daily injection, this may be a little bit more of a problem. And the key is just to switch sites. So if it does get irritating in one, don't keep injecting in that same area. But the ones that are a little bit more concerning, or something we should definitely be more on the lookout, is risk of pancreatitis and gallbladder issues. If you already have problems with pancreatitis, if you already have issues with your gallbladder, potentially these medications may not be the best and safest for you, or if you have a history of thyroid tumors, especially medullary thyroid carcinoma is a type of cancer of the actual thyroid. If you've had that cancer in the past, it's probably best to avoid this medication as well. And what's very important, If you're pregnant, do not take this medication. There has been some studies that have shown some significant birth defects with babies with women who have taken this medication during a pregnancy. So if a patient's pregnant, it's not recommended that they take Wegovy, Zepbound, or any of these weight loss medication in general. But when we talk about Wegovy or semaglutide, these medications are pre-filled syringes. So just like we can see over here, these little pens, they almost look like an EpiPen. This pen has the medication in it, and you just have to inject it. Generally, it's just like an EpiPen setup where you grab the pen, you load it, you put it up to your skin, you deploy it, and once you deploy it, you hold it onto the skin for about 10 seconds. The target for the medication is the subcutaneous region, and subcutaneous region just means fat. So it's very important to inject it into an area that has a little bit more fat in it. So whether that's the abdomen, the thigh, the upper arm, don't put it like in the tip of your elbow or tip of the finger where it's just not much fat there, because the medication does best when it gets injected into fat. It's a pre-filled pen, single use. Aiming for the actual subcutaneous region where it's the fat. It's a weekly injection. Now, there is an oral option for Wegovy. Oral option must be one, taken every single day, and two, when compared to the injection, it's not as effective when it comes to weight loss. So if all things are equal, I always try and see if the patient can tolerate and take the Wegovy injectable out over the oral. So here's the dosing schedule. For the first month, you take a quarter of a milligram, so 0.25 milligrams every single week. And after 1 month or 4 weeks, then you graduate over to half a milligram. If side effects are very minimal, no problems with the medication during that time period, can increase. And then for another month at this dose, if no problems, then increase it again, and increase it again to a total of 2.4 milligrams every single week. And now, if for whatever reason a patient finds they can't tolerate any more than 1 milligram or wherever they are in this progression, if they just can't progress because of issues with the higher dose, they can remain and stay with the lower dose. We can see from this prior study that even with semaglutide or Wegovy at 1 milligram, the patient still noticed almost a 6 kilo weight loss compared to their baseline weight. So even if the patient stays at this level and doesn't reach the max dose that we recommend, they can still get some good amount of weight loss. So it's just a matter of going until you feel that you can tolerate it. And if you max out, great. If you don't max out, you can stay where you are. Now for Tirzepatide or Zepbound, same idea. You can get a pre-filled injection pens. So same idea, you want to put it into an area that has a good amount of fatty tissue, deploy the actual needle, hold it for about 10 seconds, let all the medication go into the fat, and let it get absorbed, and you have to repeat it until the very next week. But for Zepbound, they also have vial, and so that will just give you a nice little clear vial of medication. You can take the medication out in a syringe and inject yourself, the same idea, just you have to measure it out yourself. Typically, when this is available, they can be cheaper, but it's very much case by case. Again, same as with Wegovy, this is a subcutaneous injection. It's weekly, but there is no oral option when it comes to Zepbound. It's just injectable. And the same as Wegovy, you start off at a lower dose, in this case 2.5 milligrams. After 1 month, increase to 5, 7.5, 10, and max out at 15. As long as you're not having any significant side effects, you can just progress accordingly until you get to the max dose. But if at some point you do feel that the medication just causes too much of that GI concerns, then we can stop and reduce you back to the prior dose. And again, in this study, we can see here at 5, 10, 15 milligrams, you still had 7, 9, and 11 kilos lost. But in general, whenever you're taking any of these medications, whether it is the two most popular ones that we're talking about right now, or any of the other ones, the main goal is that after about 12 weeks of taking the medication, you should have about 5% weight loss. At that 12-week mark, you should be very close, if not at the maximum dose. And at the very minimum, taking the maximum dose that you can tolerate at that time, just so you can progress and see the medication is working for you. But if around 12-week mark, we're not able to get that 5% weight loss, it just tells us that it's time to move on, maybe try a new medication or try something else. But these medications should not be taken in isolation. It's part of a treatment plan. And usually these first 3 steps I try and do immediately, even before the medication is indicated. The first one here is behavioral counseling. Now, this can be done with a counselor. It can be done online, it can be taught by yourself, it can be done with your doctor, depending on the comfort level of your doctor. But the whole goal of this is to really understand your habits when it comes to food and your activity level. So this may include taking logs of your weight, of what food you've eaten, your physical activity, sleep. And the main idea is try to figure out, okay, what am I doing? Understand that well so that we can really understand what changes we're going to do. Crucial to find out what are the goals that you actually want. Sometimes weight in and of itself is not the goal. It could be having more energy, having your having your clothes fit better, improving your sleep, being more active, being able to take just less medications. All of those reasonings are very productive and can be very motivating to have greater weight loss, but that only comes once you actually understand your behavior and figure out what is actually going on. Then comes nutrition, and the key point here is making food more intuitive, understanding what is a carb, what foods have higher carbs, which foods have higher protein, so that then you can implement that and improve your overall diet. But nutritional counseling is key for that reason. Then comes increasing physical activity. The goal is about 150 minutes a week of moderate intensity exercise. Now, what does that mean? Exercise can be broken down in a very simplistic view, but it can be helpful. Exercise can be broken down into three categories: low intensity, moderate intensity, and high intensity. Low intensity just means when you are exercising, while you're doing the exercise, if someone comes and wants to talk to you and ask you to even sing, you can sing and still do the exercise that you're doing, whether it's walking, swimming, riding a bike. So the level of exertion is still allowing you to have enough reserve so that you can sing. It does change from person to person. What one person considers low, the next person may not consider low. But for that particular person, if that person can sing while doing that activity, that's considered low intensity exercise. If a person doing the exercise and they cannot sing, if they were to sing, they will have to stop doing the exercise. They couldn't do both, but they can still talk. So if you can talk through an exercise, but you can't sing, that is considered moderate intensity exercise. And if you can't sing and you can't talk while doing exercise, meaning if you want to talk to a person, you will have to stop doing that exercise will be considered high intensity. And so the goal is to work your way up to 150 minutes a week of moderate intensity. It doesn't mean tomorrow, it just means over time. So if we try and do these three interventions, plus we then tried the pharmacological interventions that we just spoke about with these medications, if all of those aren't working, that's when I would recommend bariatric interventions. Now, we could definitely skip to this sooner, very much case by case, but in general, typically I reserve this after we try and do all these interventions. For bariatric procedures, the BMI for the patient typically should be over 35, or it could be over 30 if they have other issues like diabetes, hypertension, etc. Or if they're just over 30 and it's just not getting better. In those patients, then bariatric surgery might be something to consider. But now the question is, how long should these medications be taken for? When it comes to weight loss specific, meaning you're taking this medication for weight loss, it's not very clear. The longest studies that we have for weight loss specific is about 2 or 3 years, maybe 5 in some cases, but we don't have very good long-term data. From my perspective, I try and minimize medications that patients take, and so I don't necessarily encourage this medication to be taken long-term because we don't know what the long-term ramifications are for these medications. But it's an important discussion to have with your doctor and just weigh the pros and the cons and determine what's best for you. I hope you find this video helpful. I'll see you guys next time.